Hi, my name is Sierra. I'm going to be your nurse today. For this Teach Back video presentation, I'm going to be talking about insulin administration. For the purposes of this video, I did not have any insulin needles on me, so we are going to use this 10 ml normal saline syringe and just pretend it's an insulin needle. I did not have the resources available to me to get some, but we're just going to practice anyway. So for my teach back demonstration, what I want you to be able to do is communicate with me how you would check your blood sugar, how you would know how much insulin to draw up, and how you would prep the area and how you would administer the insulin injection. Most patients now are sent home from the hospital with an injection pen, at which point you will just get a pen that's like this big, and after checking your blood sugar, you will know based on whatever scale your doctor provides to you how much insulin you'll be administering, and there will be a dial on the end, and you will just switch it to how many units you're administering, whether it's 1, 2, or more. Okay? While we're in the hospital, we do have insulin syringes. Some patients are sent home using these, however, it's not very many. So what we're going to do first is we're going to check your blood sugar. Okay? The way that you do that is we're going to wipe your fingertip with an alcohol pad. Okay, we're gonna wait for it to dry. We don't blow on it or do this because that just brushes all the bacteria back on the area we just cleaned, so we just wait for it to dry. After it's dry, and we have our glucometer all set up for checking our sugar, what we're gonna do is we are going to just kind of pinch the finger a little bit like this, and we're just gonna do a poke, okay? And then we do a first drop of blood, and then once we have that first drop of blood, we just wipe it away. Okay, we wipe it away with a cotton swab or a tissue paper or a towel, something like that. And then we use our second drop that we get, and that's what we check our blood sugar with. And then we just wait for the results. And let's say the results are 160. Okay, so and since we're in the hospital right now, that would give you just 1 unit of insulin. So then what I'm going to do is I'm going to go and get the insulin, and we're going to pull it up, okay? Now we're going to take the vial, all right, and we're going to wipe off the top of it with alcohol. After we wipe off the top of it with alcohol, we're going to take our insulin needle and we're going to stick it in there. And we're just going to pull out for 1 unit. Oh, got to take the top off. All right, this is my fake insulin needle. I know it's not standard, but this is all I got. So we would just take out 1 little teeny tiny unit. So for the purposes of this demonstration, we'll just say this is 10 units, not 10 milliliters, okay? So this syringe can only hold 10 units. So what I would do is I would just pull up to 1 unit, okay? Boom. And then once I have it in there, I want to make sure there's no air bubbles. So you would flick it to the top to get all the air bubbles. And then you just push the air bubbles out. But I don't have any air bubbles, so it's okay. All right, and then normally our insulin needle would also have a needle, but I don't have insulin needles, so I'm sorry. Then what we would do is we would recap it, and we do that by not actually touching the needle because that's how we get accidental pin pokes, and we just kind of do a scoop method, and we scoop it up, and then we just pop it back on. If you're at home, you won't need to do that because you can just automatically stick it right in some subcutaneous area. Now what subcutaneous area is it's like the first layer of skin, a little bit of fat. So the most common places for people where they like to give their insulin injections is somewhere in the abdomen. A lot of people also like to do the back of their arms. You can also do your legs if you really wanted to. Any area that has subcutaneous fat. So anywhere around the abdomen, arms, legs, it's pretty good. The best absorption, though, does occur at the abdomen, so I would recommend that site. Another thing is that over time you want to rotate your sites, so that way you are not developing any type of nerve damage or nerve pain, and you don't have any issues with increased or decreased absorption due to scar tissue buildup after doing your pin pokes over time. So what we're going to do for our injection, because we've got our 1 unit, okay, our 1 unit of our fake air insulin, and we're just gonna, we'll do the back of my arm because you can see that. We're just gonna wipe that with an alcohol swab, and again, we're gonna wait for it to dry. We're not gonna blow on it. We're not gonna do this. Okay, we're just gonna wait for it to dry because we have time. All right, and then afterwards, you will just pinch the area. Well, I only have 2 hands, so if I'm gonna do my arm, I guess I can't pinch the area. But we're just gonna take our insulin needle. Okay, I'm gonna do this little freckle right here is what I'm gonna aim for because that's where I cleaned. All right, and then I'm just gonna go boom and push. Okay, I'm just gonna hold it for a second and then take it out, and boom, all good to go. Depending on what type of insulin it is, whether it's regular, which you would normally take before meals, or long acting, you may want to have a snack. If it is regular insulin that you're supposed to take before your meals, you want to do that within 15 minutes of when you're intending on eating. If it's long acting insulin, I would suggest eating a late night snack before you go to bed, something that has preferably like 1 or 2 carbs, like maybe a cracker or something along those lines. An Ensure drink is always a good option as well. For the purposes of this video, I would like for you to be able to demonstrate back to me exactly what you need to do. I think that's it. For the return demonstration, to make sure that you know how to give yourself insulin before you leave, the next time that I come back into your room, I'm just going to have you watch the whole thing. If you have any questions while you're completing the procedure, you can ask me, but I want to make sure that you're capable of doing this on your own before we actually end up leaving the hospital, because this is something that you're going to have to do for yourself as we leave the hospital. So next time I come back, we'll just walk through it together, and if you have any questions, you can ask me, and then if you're still here by the time that happens again, I'm going to watch you do the whole thing, and I'm not going to do anything. I'm just going to stand back and watch and make sure you know exactly what you're doing. Okay?